think that's all the housekeeping items, so I'll go ahead and kind of jump in. So my name is Kateri. I'm a physical therapist. I graduated from U of M Flint in 2021 with my doctorate in physical therapy. And after that, I worked for 2 years doing outpatient physical therapy. I started out mainly doing orthopedics, so shoulders, hips, knees, that sort of thing. And my boss at the time did pelvic floor. And so she asked me if I was interested. And at that point, I really wasn't. I was a new grad, just trying to kind of refine my orthopedic skills. And pelvic floor seemed really scary, and to be honest, I didn't really want to talk to people about their peeing and pooping and vaginas. I was like, no thanks, I'm good. But after just a little while of being there and seeing, how many women were coming in to see her and how full her schedule was getting, it was hard for her to fit all those people in on her schedule. I realized there is such a big need for this. There aren't many providers out there who do this. If I could help these women, why wouldn't I? Isn't that why I became a PT, to help people? So I signed up for a weekend course where I was going to be learning how to do internal exams and treatment, so assessing the pelvic floor internally through the vagina, feeling the muscles that way. And so I went into the weekend being super nervous, super scared, like, oh my gosh, I'm going to have to do this on people I don't know, they're going to have to do it on me. I was pretty scared about it. But I got through the weekend, I made it out alive, and I was still not sure. I had a little bit more confidence, but still just not sure if pelvic floor therapy really was for me, but I figured I'd keep giving it a try. So I continued to get mentorship from my boss. I took more continuing education courses, got more hands-on experience with my patients, and eventually I really did fall in love with it. Because I realized, the women who I was treating for pelvic floor were dealing with things that can be very frustrating, very embarrassing. A lot of healthcare providers can kind of just write them off. A lot of society can just kind of write it off. And these things impact so much of our lives, right? Like our social lives, our ability to exercise, to jump on the trampoline with our kids, our intimacy and relationships. Just so much is affected by the pelvic floor. So being able to help women overcome some of these issues and just feel more empowered in their bodies is something that I'm very passionate about. So after 2 years at my previous company, I started this clinic, Project Movement. So we are pretty new. We opened our doors in November. And so Project Movement, we are a small family-owned business. My husband Kurt and I opened it together. And obviously I see pelvic floor therapy, but I also do orthopedic physical therapy as well. And I see strength and fitness clients. And really our goal with Project Movement is to provide excellent one-on-one care so that we can help each individual who comes in our doors reach their goals and live an active, healthy lifestyle. And I think that one-on-one piece is really important because in the physical therapy world, a lot of places have shifted to this model where the therapist might be treating multiple patients at once, or they might see you for 20 minutes of your visit and then pass you on to a less experienced staff member. And with treating pelvic floor, it's such a private area of the body. It's very involved, very complex. So having that one-on-one time with my patients for a full hour, I think is incredibly important to providing good care. So like I mentioned, I'm married. My husband Kurt and I have been married for 2.5 years. No kids of our own yet, hopefully one day. So I'm not a mom myself, but I am an aunt. I have 10 precious nieces and nephews who I just love to pieces. And being an aunt has definitely given me some insights into motherhood. As I've seen, my sisters and my sister-in-laws have children, both the joys that motherhood brings, but also the challenges as well. Through each phase, whether it's during pregnancy postpartum, raising a toddler, raising a 6-year-old. All of these phases kind of present unique challenges. So I just want to give all of you ladies here a shout out for all of the incredible things that you do for your children and families every day, and for taking the time to be here tonight to invest in your health and well-being, which I'm sure can often be kind of put aside. So this is what we'll be going over tonight. So we'll start with what is the pelvic floor, what does it do, what happens when it's not doing what it's supposed to do, some general good habits for promoting a healthy, functional pelvic floor, and then a few things about pregnancy and postpartum. And so before I begin, I do want to say, all of these things I could spend hours talking on. They're all very complex, and I could go pretty in depth, but obviously for the sake of time tonight, I just tried to kind of pick out like key important things on each of these that I think will hopefully be good takeaways for you so that you can leave tonight feeling just more informed and educated. So starting out, what is the pelvic floor? So the pelvic floor is a group of muscles that sits from the pubic bone, you can see here, to the tailbone, and then along the inside walls of the pelvis. And their job is to support the organs in the pelvis. So the bladder and urethra, the uterus and vagina, and the rectum and anus. And so what those muscles do, so I've got another view here that I kind of like to, it's loading, sorry. But basically, so these muscles, okay, there we go. So this kind of gives you a better three-dimensional view. So to orient you, so pubic bone, tailbone, so, and then, like I said, it kind of goes along the walls of the pelvis. And the muscles create like a trampoline effect. So if you think about a trampoline, it has to have a certain amount of tension at rest. It has to be able to expand, to kind of go down, and it has to be able to lift up as well. So our pelvic floor is the same way. It has to have a certain amount of tension at rest to support those organs, but it has to be able to go down, to open up when we're having a bowel movement, when we're having sex. It also has to be able to lift up and close off when we're trying not to have a bowel movement, when we're trying not to pee our pants. And so what can happen sometimes with our pelvic floor is it can become too tight. So if you think about a trampoline where those springs have been pulled really tight, it's not going to give, it's not going to have that ability to relax. And so what happens in our pelvic floor, what can happen is it doesn't relax. It can make it hard to have a bowel movement. It can make it difficult to have sex. On the other hand, our pelvic floor can become very loose and stretched out. So again, think about that trampoline. If those springs have been stretched, it's going to kind of droop and sag, right? And that's where we can kind of run into issues like prolapse, which is something that I'm going to talk a little bit more about in a bit here. And so this is something that I'm assessing on my patients when they come in to me, or come in to see me, is I'm assessing, their pelvic floor to see, is it really tight or is it more loose, areas that are stretched out. And so doing an internal assessment, if they're comfortable with it, can be really informative because, sometimes certain things tend to happen with a tight pelvic floor or a loose pelvic floor. But sometimes we can have issues with either. So for instance, leaking when we cough, sneeze, or laugh. That can happen because our pelvic floor is very loose, and so when we sneeze, there's that pressure downward, and those muscles aren't closing off the urethra, and so we pee our pants. Or we can have a very tight pelvic floor, so again, we have that pressure downward, and if those muscles are too tight and they're not absorbing that impact, we can have leaking with that as well. So when my patients come in and see me, obviously I'm listening to the symptoms that they're telling me, but then being able to do a hands-on internal exam can be really helpful to kind of figure out what direction we need to go with treatment. So some of the different factors that impact the pelvic floor, so obviously pregnancy and delivery will cause over time, as the baby grows, there's going to be more weight and pressure, and those muscles are going to become stretched, and then obviously when we give birth, they're going to stretch even more. Stress levels So if you tend to hold a lot of stress in your body, if you tend to clench your shoulders, clench your jaw, you might be clenching your butt and your pelvic floor as well, and that can lead to some tightness over time. Diet and nutrition, hydration, exercise, flexibility, hormones. I'm not going to go into each of these, but just understanding that there are a lot of aspects of our lives that play a role with our pelvic floor. And so it is a complex system, and it can kind of take time to really tease out what's going on that might be leading to some problems. So kind of going into a little bit deeper, some common problems that we can have with our pelvic floor. So starting out with our bladder, so I mentioned earlier leaking with coughing, sneezing, laughing. So for instance, when we sneeze, we have increased pressure in our abdominal cavity. That pressure pushes down on our bladder. And if our pelvic floor isn't doing its job to close off the openings, then we can have leakage with that. Leaking with running and jumping, same idea. So when we run, every time our foot hits the ground, there's going to be pressure transferred through the body, and that pressure can cause some leaking. Urgency and frequency. So urgency is when we're just going about our day, and all of a sudden we have a really strong urge to pee, and it's like, I have to get to the bathroom right now, and we find ourselves running to the bathroom and maybe peeing our pants on the way. And then frequency, that's when we're having to go to the bathroom really often, like every hour or multiple times an hour. And then issues that we can have with our vagina, so pain with intercourse. So again, sometimes when our pelvic floor is really tight and we can't relax when we're having sex, this can lead to pain. It can even lead to the inability to have penetrative sex. Prolapse. So prolapse is where either the bladder and or the rectum kind of start to fall down towards the vagina. And so this can happen because the connective tissue that holds those organs in their place becomes compromised. So this can happen with pregnancy and delivery. It can happen with aging. It can happen with a hysterectomy. And so that can lead to feelings of pressure, bulging, and might feel like your vagina is going to fall out of your body. And then moving on to our bowels, so we can have issues with constipation. So again, thinking about that really tight pelvic floor that we're always clenching. If we don't know how to relax our pelvic floor, it can make it really hard to go to the bathroom or have a bowel movement. And then bowel incontinence as well. So leaking poop when we cough, sneeze, or laugh, that can happen as well. So all of these things, they are common. They happen in a lot more women than I think we realize, but they're not normal. Just because it's common and it happens a lot doesn't mean that it's normal. There are things we can do to either prevent these from happening, or if you are having these issues, there are things that we can do to make them better. All right, so now I'm going to move into some good habits for a healthy pelvic floor. So starting out with diaphragmatic breathing. So this is something that I use with probably 90% of my patients. And it's because our diaphragm, so that's the muscle that sits at the base of our lungs, kind of along the bottom of our ribs there. And it works with our pelvic floor. It helps our pelvic floor relax, it helps it activate, and it helps manage pressure within that abdominal cavity. So again, our diaphragm sits at the top of that abdominal cavity, and then our pelvic floor at the bottom. So when we take a nice deep breath in, our diaphragm moves down, our ribs expand, and our pelvic floor moves down and relaxes. And then when we take a deep breath out, the diaphragm moves up, and then the pelvic floor moves up and activates. So they work together in a system. So if we're not breathing with our diaphragm, if we're breathing more through our chest muscles, then this system can become weak, and so we need to activate it and strengthen it. So how I think the best way to explain how to do this is I'll have you, and you can even try it here tonight. So basically you're going to place your hands kind of along the sides of your stomach at the base of your ribs there. And you're going to take a nice deep breath in your nose, and you're going to think about kind of pushing your hands out. So breathe in your nose, kind of think about pushing out, relaxing your stomach and your ribs, And then as you breathe out, you're gonna blow out your mouth with a little bit of force like you're blowing out candles. So nice deep breath in, and then out like you're blowing candles. One more time in the nose. And then out the mouth. Good. So this is something that, again, whether the goal is to relax or to strengthen the pelvic floor, I use this a lot. I incorporate it with different exercises or stretches or just kind of throughout my patient's day. I'll tell them, just try to check in with your breathing and see, are you breathing through your chest or are you breathing with your diaphragm? All right, so then some good bowel habits. So eating plenty of fiber, so fruits, veggies, whole grains, and then staying hydrated as well. Both of those things are important for keeping our bowels regular, having stool that's easier to pass. Relaxing and breathing, don't strain. And so what I mean by that, so when we're having a bowel movement, if we find that we're like clenching and like pushing down with a lot of force and not breathing, that can make our muscles more tight. Those pelvic floor muscles can kind of fight back. It can exacerbate problems like prolapse or hemorrhoids or that sort of thing. So rather, when you're trying to have a bowel movement, think about, again, going back to that diaphragmatic breathing. Think about relaxing, taking a nice deep breath in, and then as you push, breathe out through your mouth as you're pushing. And then using a squatty potty, that can be really helpful as well. So if you're not familiar, so it's basically a stool that sits at the base of your toilet, and you're gonna put your knees up on it to get into a more squatting position. And this is helpful because I think this diagram is kind of nice. So, so this is just regular sitting. So you can see our pelvic floor and our pelvis and our pelvic floor is in this position where this muscle here at the bottom of our rectum is kind of creating like a kink almost. So it's going to be harder to pass the stool through there. Versus if we're squatting, it kind of tilts the pelvis in a position that relaxes that muscle, it opens up the bottom and allows gravity to kind of help and to have that bowel movement so that we're not having to strain as much. Some good bladder habits. So staying hydrated. I think a lot of times if we are experiencing some leaking, there can be a tendency to think like, well, I just won't drink as much water and then I won't have to pee as often or my bladder won't feel as full. But that can actually make the problem worse because if we're not drinking enough water and we're becoming dehydrated, our pee is going to become more concentrated and that's going to irritate the bladder and it can increase those feelings of urgency. Or if we're drinking coffee but not drinking water with our coffee, coffee is another really strong bladder irritant. So that can also kind of make those problems worse. So trying to make sure that you're staying hydrated. Avoid going just in case. And so what I mean by this is, so if you've gone to the bathroom and then 30 minutes later you're about to leave your house and you think, well, I'll just pee just in case. So that's a problem because our bladder is very trainable. So if we just went to the bathroom 30 minutes ago and then we go to the bathroom again and there's just a little bit of pee in our bladder, next time there's just a little bit of pee, our bladder is going to send a signal to the brain and say, okay, we have to go to the bathroom now. So we're gonna get that urge quicker versus being able to wait longer till our bladder gets more full before we get that signal that it's time to go to the bathroom. So trying to stretch out those periods, ideally we want to be able to go 2 to 3 hours without having to use the bathroom. And then trying some techniques for urge suppression. And so what I mean by that, so when we have a really strong urge, so for instance, we're in the grocery store just doing our thing, and then all of a sudden it's like, oh my gosh, I have to go to the bathroom right now. So rather than rushing off to the bathroom, which you'll be more likely to pee your pants if you do that. So rather than doing that, a little mnemonic I like to use is freeze, breathe, squeeze, and leave. So you feel that urge come on, freeze, breathe. So do a couple of those nice, deep diaphragmatic breaths. Squeeze, so you're gonna squeeze your pelvic floor muscles. So you might be familiar with a Kegel. So what this is squeezing our pelvic floor muscles. So if you don't know how to do this, I like to tell people, it sounds kind of weird, but think about a blueberry at the base of your vagina and think about trying to pick that blueberry up with your vagina. So you're not squeezing your butt, you're trying to just squeeze those muscles around your vagina. So after you do that, and after that urge has kind of calmed down, then walking slowly and going to the bathroom. Another thing that can help is calf raises. So going up onto your toes and back down. This also sounds crazy, but the reason it helps is because the area in our brain that goes to the muscles in our foot is right next to the area of our brain that goes to the muscles of our pelvic floor. So when we turn on those foot muscles, when we do a couple of calf raises, it helps to activate those pelvic floor muscles as well because those pathways are very interconnected. All right. So then another helpful thing can be working on some relaxation throughout our day. So this is especially for those folks who do feel like maybe they have a more of a tight pelvic floor. And so I know this sounds probably crazy. You're moms that have a million things to do. When do you have time to relax? You don't. So I'm not saying like take 30 minutes out of your day and meditate, just trying to be more aware as you go about your day. How are you breathing? Are you breathing through your chest or are you breathing through your diaphragm? Are you clenching your shoulders? Are you clenching your jaw and clenching your butt? If you are, think about softening all of that and relaxing. So you can do this, when you're driving in your car, when you're sitting at your desk at work, when you're doing dishes. Again, just trying to kind of check in with your body throughout the day and kind of see where things are at. And then working on strengthening your pelvic floor as well. And so with this, I really emphasize strengthening our core, our abs, and then our glute muscles as well. And so in the past, pelvic floor therapy was very focused on doing Kegels to strengthen our pelvic floor. So that squeeze exercise I just went over with you. And Kegels can definitely be helpful when we are consciously trying to not pee our pants. But as we're just going about our day, we don't have to normally think about squeezing those muscles, right? They just do their job. When we're walking, when we're running, those muscles should just turn on automatically. That's because they work with our glutes, they work with our core, they work with our diaphragm, they all work together in a system. So working on strengthening that system can be really effective. And so obviously there's a million exercises out there and it can be hard to know where to begin. And so this is where it can be helpful seeing a pelvic floor therapist because I can assess the strength in your glutes and in your core, and check side to side, is one side stronger or one side weaker. And then I like to do with my patients, again, if they're comfortable with it, I'll do an internal exam in standing. So I'll get them off the table and I'm feeling in their vagina, I'm feeling those pelvic floor muscles and what are they doing when you squat, when you lift something overhead. Is there a lot of bulging or pressure in one area? Are you compensating? And then that kind of helps me determine, what exercises are going to be the most effective. Where do we begin? And then how do we progress them and make things more challenging so that you can get back to those activities that you might not be able to do right now. If you're not experiencing weakness or think you do have issues in regard to that, just continuing to incorporate exercises for your core and glutes, so things like bridges, squats, planks. If you aren't doing those, just try to kind of throw those into your day when you do exercise, and those can be helpful for maintaining the strength that you have. All right, so now I'm going to go into a little bit on pregnancy and postpartum. So during pregnancy, obviously our pelvic floor is very much impacted. As baby grows, there's going to be more weight. Those muscles are going to get stretched over time. Our abdominals are going to stretch. In most cases, we're going to have a certain amount of separation of our abdominals. You might have heard of this, diastasis recti, so that's where those abdominal muscles separate in the front. And this is all normal because our body needs to make room for that growing baby, right? But there are things that we can do to maintain some of that strength so that we can support our pelvic floor throughout pregnancy and then lead to a better recovery after. And then just some general guidelines for exercising while pregnant. I think in the past, women were told you shouldn't run, you shouldn't jump, you shouldn't lift heavy things when you're pregnant. But now we understand that, those things are safe to do if you were doing them prior to pregnancy. So if you were running, if you were lifting weights or doing HIIT classes before you were pregnant, you can keep doing those things while you're pregnant. And really it's gonna be, the best thing for your health and for baby's health to be getting regular exercise. But obviously we do want to be making sure that, we're not experiencing any symptoms. Obviously your body is changing, and so just being aware if you are, having anything like heaviness, any leaking, any pain, like pain in the pubic bone or in the back and hips can be pretty common. So definitely check in if you are experiencing those things. And it doesn't mean that you need to stop exercising completely. It just means maybe we need to dial it back for right now and incorporate some other things to strengthen our abdominals and our glutes and our pelvic floor. And so again, this can be helpful to come see me if you want any guidance during this time, because I'm sure that it can be scary, especially if you're a first-time mom and all that. Obviously, you don't want to do anything that would risk your health or baby's health. So just having guidance on what kinds of exercises are appropriate can be really helpful. And then working on breathing. So again, going back to that diaphragmatic breathing, that can be a really nice thing to practice during pregnancy to prepare for birth, so that you are able to relax and then breathing out while you're pushing. That can be really helpful to minimize the risk of tearing versus when we're pushing and holding our breath. That can create more of a risk of tearing. So working on some breathing as you're preparing for birth and then while you're giving birth as well. And then working on stretching. So there's a lot of prenatal yoga videos and classes out there. So anything that can help to stretch the hips and kind of open up that pelvis to prepare for birth. If you want any more guidance or specific stretches, I'd be happy to help you with that. So another thing that we can be doing is perineal massage. And so if you haven't heard of this, this means you're going to insert a finger, or you can use a pelvic wand, which I have an example of what that is, which honestly at this point, you're gonna be working around the belly, so this will probably be easiest for you. So what you're gonna do is you're gonna insert the pelvic wand into the vagina, and you're gonna stretch it in multiple directions, and that's gonna help prepare that tissue to stretch for delivery, and it's gonna help minimize your risk of tearing. So starting to do this around like 30, 34 weeks, and doing it for a couple of minutes each day. And then moving into postpartum. So I think women used to be told in the past as well that during the first 1 to 6 weeks you really shouldn't do much exercise, that you should just let your body relax and recover, which obviously the body does need to rest and recover from what it just went through. But if we don't do any exercises during those first 6 weeks, then our body can become very deconditioned, and it can be harder when we do get to that 6 weeks and our provider might give us the green light to start exercising and working out again. It can be a lot harder on the body, and it can take longer to kind of get back into our normal routine. So doing some light abdominal work and glute work during this time to help support those pelvic floor muscles as they heal can be really helpful. And then also during this time, doing some stretches for the shoulders and upper back. While you are holding your newborn and you might be breastfeeding, all of this can become very rounded, very stiff. It can make it hard for our ribs to expand and to get nice deep breaths. So making sure that we're stretching our upper back and shoulders can be helpful. And so if you want any more specific stretches, I would be happy to give you some. And then same as during pregnancy, during this postpartum phase, we want to make sure that we are monitoring the symptoms, looking for things like heaviness, pain, leaking, increase in bleeding. If you are having those things, again, it doesn't mean that you need to stop exercising completely, but it just means maybe we went a little bit too far, too fast, and we need to kind of dial it back and adjust. So again, this can be helpful where working with a pelvic floor therapist for some guidance. To wrap up and summarize, so the pelvic floor create that trampoline structure that helps to support the uterus, vagina, the bladder, and the rectum. And issues can arise when the pelvic floor becomes too tight or when it becomes very loose and stretched out and weak. And there are ways to promote a healthy, functional pelvic floor during pregnancy, during postpartum, throughout our lives. So hopefully some of these tools are helpful for you tonight to kind of incorporate into your lives and prevent issues from arising. If you are having problems, I do, again, just want to emphasize that you are not alone, and there are things that we can do to help. These different problems, they might be common, but again, they're not normal. You don't have to live with a leaky bladder. You don't have to live with painful sex. Pelvic floor therapy can help. And so I know I've talked tonight about different aspects of what therapy looks like, from that internal exam as well as looking externally at that whole system that's involved, and then going into guided exercises, stretches, breathing, having hands-on manual therapy. All of these things might be involved in your treatment plan, and everyone's treatment plan is going to look a little bit different because we are each unique individuals. And so that's why it is so important to me that here at Project Movement, I see my patients one-on-one for that full hour, so that we can really kind of dive in and get to the root of what is causing your problems, what is going to help them now, what's going to prevent them from coming back in the future, so that you can live an active, healthy lifestyle. So that is everything that I have for you tonight. Does anyone have any questions?